If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who keeps the weirdo alternative wacko medicine idiots off of my ass. Thank you, Dr. Scott.
My pleasure, Dr. Steve.
This is a show for people who never listened to a medical show on the radio or the internet. If you've got a question that you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. And follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. Yeah, very good. Yeah, for real, don't do that. Tacey will be along later. Please don't forget stuff.drsteve.com. That's stuff.drsteve.com for all your Amazon and online shopping needs. And Dr. Scott, you helped me set up my tilt table, which is basically an inversion table for back pain.
Mm-hmm.
Greatest thing I've ever bought.
Good.
And if you want to look at it, go to backpain.drsteve.com. And you got to spell out Dr. Steve, not just Dr. Steve. Backpain.drsteve.com or go to stuff.drsteve.com. You can see the one that I bought, and it's worth every penny, I'm telling you. It's under $500. It was a little bit of an investment, but it was easy to put together, and it has changed my life for the better. And check out if you want to lose weight with me, because that's helping me with my back as well. Noom, Noom, is a psychology program, not a diet, that helps change your relationship with food. It's been very successful for me. I'm getting ready to be on my third year. I love it. It's a new lifestyle. I can't imagine living any other way. Noom, Noom.drsteve.com. We'll get you 2 weeks free. You can try it out. If you don't like it, to hell with it. If you like it, you get 3 months at 20% off. You get a counselor, you get a group counselor. You have these little modules that you do. It really takes 5 minutes every day. You log your food. No points, none of that. It's easy. It really was pretty easy.
Yep.
And it starts to shift your thinking toward ways or, to more functional behaviors that you end up losing weight and maintaining it. And then Dr. Scott's website at simplyherbals.net. You got any nasal spray on there yet?
Not yet.
Are you ever going to have it? I mean, seriously, if you're not going to have it, I'll shut up about it.
I swear. I don't
you
know
swear. Okay, everybody heard that. He swears.
I don't know what the hell's going on. I'm not paying him enough, obviously.
Who, your webmaster?
No,
Let me do it. I can put it on there right now.
No, I know.
Oh,
I have it on there. 1 week.
You are a jam genius.
1 week.
All right. Okie doke. Well, we're going to do a COVID-free show today, I think.
Cool. Give it a try.
I mean, what's going on in India is disturbing. If that is a new strain, then we're dealing with a whole new pandemic. But let me tell you something. If it is, and I don't have any evidence that it is, it could be that they've got 1 billion people and you only have a few tens of million people vaccinated. And people are just sick of social distancing, and so people are getting the virus. And If it is a new variant that is resistant to our immune systems, I have full confidence that the mRNA vaccines can be retooled within a month or two to have us a booster that will also, or actually a new vaccine for this new variant if we need one.
Right.
They won't have to go through the 9 to 12 months worth of studying that they did before because they've already done the safety studies. This is just a tweak, so it's really not necessarily a new vaccine. So variants can go through a lot faster phase 3 trials than the other ones do. So I think we'll be just fine with that.
That'd be wonderful.
And let's bump it out. I hear people saying, well, the first world countries are keeping it from the third world countries. I hope that that's not true. My understanding is that it's been almost 1 billion people in this world have been vaccinated, and that's way more people than are in the United States and way more than have been vaccinated here. So I'm hoping that we are not being assholes about the vaccine and we are, sharing it with other countries and stuff like that, because everybody who wants it should be able to get it.
Yes.
In my opinion.
Agreed. Totally agreed.
But anyway, all right. Very good. Hey, would you do me a favor? And while we're sitting here talking, would you text my wife and tell her to come up? I think she may be free. We haven't had Tacey on the show in way too long. During the pandemic, it was great. She was home every day. And now her job has reopened, and now she's on the road 3 nights a week. Which you would think, oh boy, you're a bachelor 3 nights a week. I do get to do some ham radio and some other things like that, but I also, lose out on watching TV. We have to watch everything all at once. When she gets home, there's so many cool things on now. Mm-hmm. So, but Liam, my oldest, is now 18, and so he and I are watching Alone. Have you ever watched that?
No, I haven't.
It's called Alone.
Yeah.
They take people, and I'm sure you've heard of Naked and Afraid. They get these people who think that they are survival experts, and they strip them of all their clothes, and they throw them in this thing, and then they just, most of the time,
meltdown.
Yeah, it's not good.
Oh God.
But these people are like people who make a living teaching other people how to do survival. And here she is. Yay! Here's Tasty. Yeah. Hello. Oh, I almost hit the... There you go. Hello, love. I've got your mic off, so just go ahead and switch it on. Okay, it brings the show to a screeching halt. There we go. All right, there you are.
That's what I do.
Well, so how's it been? You have not been on the show in many, many weeks. Your fans are clamoring for you to return.
Oh, clamoring, I'm sure.
And how's it? So what's it like being back out there in the field?
It's all right.
Is it? Yeah, I guess that's what you got to say, right? Because people from your company listen.
You love it. You know you do.
I'm adjusting. I'm figuring it out.
Yep. And we're going to retire just as soon as we can, right?
I'm adapting, yes.
Okay. Yes.
We? All of us? Or is this you two? Am I included in this?
You can retire anytime you want to.
Thank you.
You're Mr. Moneybags.
Yeah, buddy.
This guy, he goes to Florida.
Loaded.
He drops $250,000 on a beer store.
Yes.
And just doesn't even
all for fun.
Think about it.
Just for fun.
It's
buddy. If it wasn't that damn thing, we could all be retired now, couldn't we?
You think? Well, I didn't lose nearly as much as you did.
Well, it was the aggravation the loss is the aggravation.
I gotta before we get on to the questions, we got 1 million questions.
Cool.
I want to give a plug to my friend Mario. Mario is a gentleman of Polish descent, which doesn't have anything to do with anything, except he lives in the in the EU. He's living in Ireland now, which is, I don't even know if Ireland's part of the EU anymore. I'm very confused. But he runs a company called GeckoLogic.com. And they make this thing called the Gecko Loop Synth, which we've had on this show before. He also has another website called Phonic, Phonic, Bloom.com, where he makes kind of related instruments. He has the polyphonic whale, which the wooden version is now sold out. And he has Gecko loop synths on there in wooden cases and stuff. But he's got a new thing called the MMXXT-APE. So it's mixtape, right? And it's a byte beat sequencer and fractal explorer.
Stop it.
And he sent me one. And I just turned it on just before the show. I can barely make it do anything, but I did find something that I can make it do. And it's very 8-bit, kind of 8-bit sounding stuff. But I think that you can do some granular things with it to make these 8-bit sound differently. But here, let me. So it's a little sequencer.
Is he talking in Spanish?
I don't know what the hell he's talking about.
What are we doing?
Scott and I are gonna jam.
You stepped into an alternate
to Mario's
dimension.
thing because Mario lives in another country. Now we're gonna jam with him. Ready?
Yep.
It's a little out of tune. Where are you, Scott?
I need volume. Give me volume. Give me volume, baby.
Is this what you guys do now? Is this what we do?
Anyway, check out Mario at, I don't know what happened to Scott on that one, but check out Mario's genius little instruments, and they're very inexpensive too, at phonicbloom.com. And we don't get anything for it. He's just a friend. So anyway.
Good failer.
And if I figure out how to do some other cool things with this thing, I'll bring it back. But I literally opened it a minute ago before the show.
Yeah, I'm surprised you got to do that much.
I bet we'll get a dang copyright hit on YouTube over that for some reason.
Or maybe a link to YouTube where you know how to play.
Last show I played the Tucci Band Train song or Train Blues or something like that by Steve Tucci, who is he who bones, she who owns pigs and snakes on the podcast. And we got a copyright hit from CD Baby. Now, CD Baby is one of those places where you send your tunes and they'll make CDs for you. And apparently they're very proprietary about CDs that are made on their service. And so we got a copyright hit on that. I'm trying to, I said, gosh, if 10 people hear this song, it's probably 10 more than heard it. Sorry, Steve, just kidding. But, before, but they get a copyright hit. So anyway. All right. You ready to do actual something?
Let's do it.
Scott and Tacey, neither one of them are I've just lost them, so it's okay.
No, I'm not paying attention.
Don't take advice from some asshole on the radio.
All right, fair enough. Thank you, Ronnie B. Let's do this.
Hey, Dr. Steve, how are you?
Hey, man.
That's a really weird question that I was thinking about.
Well, that's the right show.
Basically, when people do drugs or alcohol, that increases their heart rate. Why is that different than, cardio? I know it sounds dumb, but I guess I just am wondering what the base function is being changed. Like, your heart is just beating faster?
Yeah.
Whether you do one or the other.
That's a good question.
It's an interesting question.
Doing drugs or drinking to increase your heart rate?
So why isn't drinking and doing drugs good for you? That's what he's saying.
Why is it?
Can you just since it makes your heart rate go faster, and exercise makes your heart rate go faster,
right?
Isn't it the same thing? Tace?
Well, sometimes my Fitbit says I'm in fat burn and I'm just sitting there. And I think that's because of the Synthroid that I take. But
you're burning fat.
Yeah, and I'm
keep it up, Tace.
So I have had that same question.
Yep. So the thing is that the reason your heart beats faster when you exercise is because when you're using muscles, and of course they need blood flow.
They need oxygen,
and they need oxygen, and they start generating lactic acid. That's that burn that you get is the lactic acid. And your body needs to clear that, and to do that, your heart beats faster to try to pump more oxygen and to clear more lactic acid. Now, if I just make your heart beat faster, it may do something for or against your heart. That's fine, but it doesn't do anything for the rest of your body. It doesn't do anything for your exercise tolerance.
Right.
Now,
right.
The reason that when you drink alcohol, your heart rate goes up. Initially, if you take one drink, it's a vasodilator. Mm-hmm. And people who listen to this show for a long time know what I'm talking about when I say vasodilator, but it takes your blood vessels and makes their caliber bigger.
Mm-hmm. Relaxes them.
And when you relax the blood vessels, you have the same volume of blood going through a larger area, right? So the pressure has to drop.
Less resistance. Yep.
Exactly right.
Yep.
So if you remember your elementary physics, that relates flow with pressure and resistance. The way I always remembered it when I was a kid learning ham radio was eagle equals Indian over rabbit.
Okay.
Is that right? No. Indian equals eagle over rabbit.
Okay.
So I equals E over R. That means the current or the flow equals the pressure divided by the resistance. Mm-hmm. So if the resistance goes down, the flow has to go up, right? Mm-hmm. And concomitantly, the pressure drops. So if you drink one drink, the blood vessels relax, your blood pressure drops, the heart has to beat faster to
maintain that pressure.
To maintain. Now, if you drink more than one drink, then it becomes a vasoconstrictor. And then you go, well, why is the heart beating faster? Well, because there's a second thing that happens when you drink a second drink is you start getting activation of the fight or flight mechanism. So you start pouring adrenaline into your system, and the first thing that does is make your heart beat faster to pump more blood, because if you're trying to run away from a saber-toothed tiger, you need more blood pumping everywhere.
Yep.
And that's it.
And hey, Dr. Steve, what do you think about the dehydration component of it too, causing a little bit of an increase in the heart rate?
Absolutely.
Bit, yeah.
So there's
with the alcohol.
I'm going to give you one of these.
Give yourself a bill.
Because it's multifactorial, isn't it?
Yep.
Alcohol can act as a diuretic. Most people notice when they first start drinking, all of a sudden they start pissing.
Right.
And my roommate in college used to have that phenomenon, but he would be passed out at that point, and so we would be at a frat party, and there'd be a bunch of cool girls hanging around, and he'd be passed out on the couch, and all of a sudden he'd just start pissing his pants. And when you do that with jeans on, it's pretty obvious. Mm-hmm. And then we'd have to pick him up, and the look on the girl's face is just like, ew, he is so gross.
I think it's a mood killer there, isn't it?
Yeah, a little bit.
I don't know.
And he wondered why he never got laid in college.
Poor kid.
He was an interesting guy. When I first met him, first off, there were supposed to be 3 people in our dorm room, right? And we knew he was a sophomore. The other guy that was in there was a freshman. His name was Rob Arrighetti. And this other guy, whose name was Richard, didn't show up for a week. We figured he wasn't coming, And then one day I walk in, and there's this guy on the top bunk, and he was passed out. And I didn't talk to him for 2 days. Every time I'd come in, he would be passed out. So anyway, he finally chased poor old Rob off, and so Richard and I were roommates. And this was Richard's. This is the best roommate you could ever have. This was his protocol. At 7 a.m, he would wake up and smoke pot. Then he'd go back to bed, totally skip class, And then at 11 o'clock, he would wake up and watch the soap opera called The Edge of Night.
Oh.
Now, The Edge of Night was a mystery soap opera written by, what was it? Can you look it up? Who wrote The Edge of Night?
Sure.
He was a famous mystery writer. And he would write that. And so he would watch that. And that's where Dixie Carter got her stop. You know who Dixie Carter is,
yes,
right?
Yes, I do.
Okay, she got her start on there. And he would watch The Edge of Night, and then he would go back to bed again. At 4 in the afternoon, he would, of course, smoke pot. At 4 in the afternoon, Henry something, right?
Elliot Lawrence.
No, that isn't who I'm thinking of.
No.
It was like Henry Slezak or something like that.
Okay, no, Elliot Lawrence did the music.
Yeah, thank you.
Hang on, let me find it.
You get it.
Hey, come on now. Hey, this. It's not like this fucking soap opera was this five years ago.
It was in black and white.
I'm having a dig here, man.
The Edge of Night. Wait a minute. I could probably do that better than that. The Edge of Night. So, and he would smoke pot. Then he'd go back to bed at 4 in the afternoon. He would get up and drive to the ABC store.
Oh my goodness!
And buy a bottle of Brass Monkey. Brass Monkey was a pre-made cocktail that tastes sort of like Hypnotic, if you've ever had that.
Henry Slezak.
I was right. I said Slezak, I think. That Slezaks were the things on the Land Beyond Time or whatever. Anyway, so it was very well written. It kind of had murder mystery stuff in it. So he would, at 4 in the afternoon, he would go buy a bottle of Brass Monkey, and then he'd start just yelling at people outside our dorm room. And we were 3 floors up in the dorm where, by the way, streaking started in 1975 in Mangum Dormitory at University of North Carolina, Chapel Hill. Look it up. We were the first ones to streak. As a matter of fact, my naked ass was on Walter Cronkite. How about that?
Now that I did not know.
I never told you that story?
No.
Okay, forget Richard. I'll tell you that story. So we had this guy in our dorm that worked at Channel 11 in Durham, North Carolina. And it was a CBS affiliate. And that's where Walter Cronkite was. So when people started streaking, he said, let's organize it in our dorm and I'll have the cameras out there and we'll put it on the news.
Oh, my goodness.
So he had it so it was behind. You couldn't see anything. You could just see asses. So, and what they did was they filled up our dorm. Our dorm was Mangum dorm, 4 or 5 stories, filled up with naked, sweaty guys. And then they go, 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 go. And then we'd come out the bottom, out this door, right? And I was wearing a Groucho Marx, the bushy eyebrows and the nose and the mustache mask and a tie. And that was it. All I had on was a tie. And you can see me running right past Walter Cronkite's face. He did sort of this feature at the end of the show. And he's, well, that's the way it is. It's May 23rd, whatever. And there's my stupid ass with this Groucho Marx mask running past Walter Cronkite's face. Well, when you're streaking and there are thousands of people outside waiting to watch this, it's cool because you're with a whole bunch of other people and they're all naked. Mm-hmm. I've never been naked in a crowd before, but you're running past these cheering crowds and all this stuff. Well, I was in a group so you just sort of followed the person in front of you. Well, somewhere in front of me, somebody branched off and decided they were going to go streak through the library. And I'm just following the person in front of me, and we go through the library and, and then run back out. The main group is gone.
Oh, no.
So we run around and try to figure out what the hell. We come back to Mangum Dorm, and that now there's no people lining the streets. It's as if the parade is already over and everybody is milling around. And here we are, and these people start looking. It's like, who the hell are these assholes?
Oh, my gosh.
Now, when you run into a crowd like that and you're naked and they're not, all of a sudden you're naked.
Shrinkage.
I understand how Adam and Eve felt after they ate the apple, right? All of a sudden they were naked. Yep. Before that, everything was fine. They eat the apple and it's, oh God, I got to put some clothes on. But except I couldn't get to my dorm because there were thousands of people out there. So I am walking through this crowd of thousands of people.
Oh my God!
Completely naked except for a tie, and try to cover up your junk with a necktie.
Let's get back to the roommate.
Oh
yes.
God.
Okay.
Is this the roommate who would just eat jelly?
Yes.
He would just eat those free jellies.
So he never had any money, and we would go to restaurants. They would have pots of jelly. And he would just eat the jelly out of the pot.
Oh my God!
He would get water and then eat jelly.
So where is he now?
Well, I don't know. I don't want to say. Oh I called him and we were going to get together, and then I never heard from him again. So I don't know if something bad happened to him or what. That's why I'm not saying his whole name.
How long ago?
But I loved the guy. He was this was one of the smartest people I've ever met. He turned me on to. Well, he didn't turn me on to Firesign Theater, but he was a fan of Firesign Theater. He turned me on to a bunch of different jazz things, Harry Parch, microtonal music, all kinds of stuff he turned me on to. His brain just couldn't handle being constrained. He would get the syllabus for the class, and he would just show up for the test. That was the only time he'd show up. And he'd take the test and he'd pass.
Wow.
He got through freshman year that way, because freshman year is a little different. It's these big giant classes. You can just show up for the test, and if you're a super genius, you can pass. Sophomore year, all of a sudden, you're doing some things in your major, and he was a radio, television, motion pictures major like I was. And he showed up 6 weeks into this television production class, and the teacher's like, "Who the hell are you? Where have you been?"
Oh my gosh!
Now all of a sudden people knew that you weren't there in those giant classes of 500 people or whatever. You
could hide.
Yeah, you just don't show up.
Yep.
But anyway, so he obviously didn't make it through sophomore year, but didn't tell his parents that.
Oh my!
So they paid for him to go back his junior year, and he just kind of lived in his car and hung out at my place and stuff like that. And his parents would go, "Hey, we never got your grades." He's like, "Oh, they keep messing up and all this stuff." And
oh goodness!
Finally, they called the school, said, "We never got our son's grades," and they said, "Well, maybe it's because he didn't attend."
Oh God!
And he flunked out his sophomore year.
The previous year.
So just imagine that you're 20 years old and your parents have to ground you.
Oh God!
So they gave him this really crappy car, made him get a paper out. So
buy a
kids who are listening to this, go to class, do the work. Don't just get up and smoke pot and watch TV and
eat jelly.
Right.
Well, as they said in Animal House, fat, drunk, and stupid is no way to go through life, son.
Right. Mr. Blutarsky. 0.0. Well, Richard had a 0.0. He was Richard Blutarsky. He was as funny as Bluto.
Oh my gosh!
Anyway, all right. I'm not 100% sure how I got off on that, but I miss old Richard though. God, he was fun. He was so much fun. But it was like watching. You just knew nothing good was going to come of it. But we had so much fun with him.
It's like watching the wheels on a fast car.
His sense of humor was so fast. Mm-hmm. He was just too smart for himself. I have some relatives that have IQs of 200 and stuff, and they are they don't do real well in this world. Mm-hmm. So, all right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Let's see what this little person has to say.
Hello, Dr. Steve.
Hey,
I have a problem where I had a urachal tract removed.
Okay.
And so part of my intestine and bladder came out with that. This was about 6 months ago now.
Okay.
I have noticed recently that when I want to pee, I have lost control of the outer sphincter in my penis. Like the one that you can kind of hold at the tip when you really have to go. I only can use the one at the base instead of both.
Hell?
Is this a problem that I should go see with my doctor, or am I overthinking things?
Okay, I don't have one of those. I don't have a sphincter at the end of my penis. Do you?
No. It's a lot more proximal, yeah.
Yeah, I mean, you have a sphincter at the base.
Yep.
And then there is a bulbocavernosus, which is if you dribble, maybe I wonder if he's just talking about he's dribbling now.
Mm-hmm.
If you dribble, it's coming from this bulbar urethra, which is at the very base. And people will try to say, well, I shake my member and I still dribble when I put my junk back in my pants. And that's because the urine isn't trapped in the end of the urethra or the tube inside the penis. It's actually trapped in the base of the penis. And what you got to do, if you want to get rid of that dribbling, is milk it from the base.
Right.
Then that'll stop that dribbling.
Yeah.
But what this guy, he had a urachus. And the urachus is a remnant of a channel that went between the bladder and the belly button, which initially drained the fetus during pregnancy when they were in the womb. Okay.
Well, they're in utero.
Yep, exactly. Yes, right. They're actually in the mother. There's this channel that goes from the bladder to the belly button area. The cord, and it's a way that they can drain some waste products, and that it usually seals off around the 12th week of gestation, and then the kid just starts pissing inside the mother, inside the the amniotic sac, and that's what makes amniotic fluid.
Right.
There's nothing else that makes amniotic fluid. It's kid piss.
Yeah. Urine.
And thank you, urine. Yes.
Urine.
Okay. I'm sorry. I used a bad word. And normally you would just have a cord. Like this fibrous cord, if you dissect in, you can see it. It's still there, but there's nothing to it. Now we have some people that when there's no sealing off of that they'll still drain out of their navel, their umbilicus, their belly button. Sometimes they'll get a cyst there. I've seen people with urachal cysts. Sometimes you'll get what's called a urachal sinus, which is where it's open on the belly button end but closed at the bladder end.
Okay.
And you can get a diverticulum too, where you just get a blooping out. I mean, there's anything that could go wrong with a tube you can have with this thing. I've had people that had bleeding out of their belly button, and it was a remnant from their urachus. So when you have a patent one, in other words, one that's open all the way, you'll have clear urine leaks out at the umbilicus or the belly button. And sometimes that can cause infection because now that's not you have a non-sterile communication between the bladder and the outside world. Because most people don't clean their their umbilicus very well.
No.
So they treat it. They go in and do surgery. Okay. Now, after the surgery, they shouldn't have any more problems, and that should be it. So I don't know what in the hell he's talking about, this sphincter at the end of his penis, unless he's just got a really strange anatomy.
Yeah, I was going to say, because anatomically, that it doesn't even begin to add up.
No. It's just kind of
close,
at that point, when it gets to the end at the meatus, which is spelled M-E-A-T-U-S, so it's spelled meatus, but it's pronounced meatus. Once it gets there, it really is kind of just a passive tube at that point.
Mm-hmm. There's little flaps at the end kind of keeping things in. Yep.
Yeah, now if he can control those flaps, he's got a career in porn.
Yeah.
But other than that, I don't know what the hell he's talking about. So I think what it is he's dribbling and just milk from the base. All you dribblers out there, don't just shake. Don't just shake when you're done. Put your hand down at the very base, right where the scrotum and all that stuff is, where the penis meets the body, and put pressure down there as far down the base as you can, and just milk it up, and that you won't dribble in your pants anymore.
Hey, and some take it one
unless you're just incontinent,
or take it one step further, just because we don't know how old the guy is, but. A lot of times we'll see dribbling with guys with prostatitis.
Oh, yeah. So I'm talking about normal, plain old dribbling.
No, I know, but I just...
Yes, sir.
Yeah, who knows?
You are correct, sir.
He may have something else going on. So.
Yeah, and if you keep dribbling despite that, then you may have a problem.
Get somebody to check it out.
Scott said. Yeah. Yes, absolutely.
Check it out.
If you think you have a patent urachus or a urachal cyst, or you're bleeding from your belly button, or you've got weird smells coming from there, or if you're dribbling and you can't make it stop just with the simple massage we talked about, you need to see somebody.
Yeah, totally.
Okay. All right. Fair enough.
Hey, Dr. Steve. It's Albert from Albuquerque.
Hey, Albert.
It's been a long time. How you guys been?
Yeah, we're doing all right. How you doing?
Great. Hey, listen, I wanted to talk to you about the recent question I had, and for something else, let me just state it's not COVID related.
Thank you.
Let's talk about my balls.
Okay.
And my prostate.
Cool.
Just recently had a situation, went to see my doctor. My prostate started elevating about a year ago in November. The PSA for my prostate came back at 5.6, up about 2 points from 2 years previous. And so we retested in April, and lo and behold, it's 6.6.
Okay.
So he recommended that I go see a urologist.
Yes.
Well, coincidentally, at the same time that I had the PSA done, I asked him, because we hadn't tracked testosterone in a long time. I was curious, if nothing else, about that. So I asked him to do a testosterone test, and he did. Well, I went to see the urologist, and the urologist did a digital exam. Good news is he feels that the prostate's enlarged, but didn't feel abnormal at all.
Okay.
I've got no family history of prostate cancer, so that also made him feel good.
In 2021, if you say digital rectal exam, people think of, you're doing some imaging study or something.
Mm-hmm.
No, you're using one of your digits. You're shoving a finger up somebody's rear end and you're feeling their prostate. That's what that is. Okay.
I have a story about that.
Okay, good.
I mentioned...
Did they check your prostate that way, Tay?
No.
Well, let him finish. Hold that thought.
My testicles, or my testosterone level to him.
Uh-oh. Oh, no!
And I think I'm around 1,100, over 1,000 for the testosterone.
What?
And he said he's not seen one really that high, and found that interesting. Part of his regular examination, he did a third exam of my testicles. I mean, he spent some time making sure the boys are
I bet
the right
they're
shape, the
nice
right
and
size,
meaty if
and
they're
they feel
putting
normal.
out that much testosterone.
He's a senior urologist. I feel very, very comfortable with him. He's actually my doctor's doctor.
Okay.
So, anyways, he's gonna. Course of action is we're getting. I had blood work drawn again to verify it was not just an anomaly or a bad lab test potentially for the testosterone.
Yeah.
And he went to get another snapshot of the PSA, and reevaluation with him in a short order after that. And he's going to do a little research on his side, and reference that he likely will refer me to an endocrinologist to take a look at the the testosterone levels if they maintain at that high level. But you're a genius, man, so I wanted to get your opinion on what you think this is. I don't think it's necessarily cause and effect. However, it's anecdotal that they're both there right now, so I'd be curious to hear any feedback you have on this.
Okay.
More importantly, I'd love to hear Casey the next time I listen to it say, that...
Well, okay, I didn't do that. You got your wish, bro. So, Tacey?
Yes, sir.
What were you going to say? And I'm going to answer
Okay,
this
so
question.
I have a friend whose husband used to always harass her about anal sex.
Okay.
And then he got a digital prostate exam.
And he said never again.
He said never again.
Isn't that something?
Because he used to tell her she'd just get used to it.
Isn't that interesting?
Yes.
See,
so he got a little bit of his own medicine.
A little empathy goes a long way, doesn't it?
Mm-hmm.
I love it.
So she got empathy and she got validation.
And
both.
freedom from...
And freedom.
And empathy and validation are two of your most powerful tools when you're communicating with someone. So he got a little bit of both. She did. So, isn't that interesting?
Isn't it?
I got the colonoscopy without anesthesia. And I'm like, I don't know what Tacey's complaining about. So, high testosterone in males. It's uncommon for high testosterone in males to happen, mainly because we have these feedback systems that prevent it. When the testosterone gets a little bit high, the pituitary says, "Hey, produce less," and then the testicles calm down. And then when it starts to drop, pituitary says make more, and then it comes back up again. And usually it keeps it in a nice even keel. Those sort of feedback loops, we see that all the time in the body, with basically with everything. There's always something that will cause the level to come up, and then something that will cause the level to come down. Those two things are always in balance with each other. And what that allows is when you have a system that way, that if you need a precipitous increase, you just shut the one pathway off and the other one can take over. And so it's a very responsive system. It's also a system that's well designed to keep things on an even keel. So it is unusual. But every once in a while, you'll see it in people that use steroids. Sure. If you're taking steroids and you're overdosing, that could happen. And sometimes supplementation can happen and you're not aware of it if you're taking something from let's say, I don't know, a supplement store and they got something weird.
Right.
You got some male enhancement thing that actually has testosterone in it.
Right.
But you can also have issues with the adrenal glands, the testicles, but sex hormone producing adrenal tumors are rare. It happens in one in every 500,000 people, men. And those can be non-cancerous too, so I just don't want this guy freaking out. But what I want him to do is to do exactly what they said they're going to do, which is the first thing you do when you get an abnormal test result that's really unexpected, just
try and do it again.
Test it again.
Yep.
Every once in a while, the lab will screw up, or you just had a weird day or something, and it just comes back to normal. And if it's trending back to normal, it's called regression to the mean. You forget about it, or for the short term. And
then check it again later.
Yeah, then check it again later. Yeah, that's right. Yeah, that's right.
Just in case.
So that's the first thing I would do is just repeat that blood work under ideal conditions. And then if it's still elevated, then absolutely go see an endocrinologist. That's what they're going to do, though, is there's some blood work that they can do to see if your testosterone is high, but the hormones that tell the testicles to produce testosterone are low, that tells you that the testicles are doing this on their own.
Mm-hmm. Okay.
Now, if it's high and those are high, then it may be that it's something in the pituitary is wrong.
Pituitary gland, yep.
So they'll look at all that stuff. Okay. And they may do some imaging too, but they'll figure it out.
Head image.
This one is less scary than most of these kinds of things. That's why I don't mind saying the T word. In most of the time, if I think somebody might have cancer, I'll just say go get checked and email me if you need further information. But on this one, it's most likely going to be something that's very treatable, and I just don't want him to not go.
Yeah,
because you think, wow, I got high testosterone. That's awesome.
Awesome, baby.
So, all right. Okie dokie. Let's try this one.
Hey, Dr. Steve, Dr. Scott. How y'all doing, gentlemen?
Hey, good, man. How are you?
All right, B.
Hey, I said, how are you? Y'all just don't listen to nothing. Okay, I'm going to try this one out for you. For some reason, I've noticed that my heart, I can feel my heart beating harder than normal, and it's to the point that my lady friend, we can be laying in bed, nothing's been done, no sexual intercourse or anything, but it just started to the point that she could feel the bed kind of jerk a little bit from my heartbeat. I've noticed that there are occasions, not necessarily when it's beating hard, but it's more pronounced when it's beating hard for no reason, that it skips a beat, and it'll beat,
and then beat. Yeah.
It has irregular skips in between it.
Yep.
So I was just curious if that was something I should be concerned about. I actually have a doctor's appointment coming up in a couple of weeks, and that is something I'm going to broach to her. But just out of curiosity, seeing what you want to hear your opinion on it.
Yep.
And I need y'all to fix y'all audio, because if you couldn't hear me when I said hello, that's your problem, not mine.
Okay, that's our problem.
We weren't listening.
We know it's our problem. We just don't listen, man. Hey, thanks for the call, and that's a great question.
Yes.
Do you know what he's got? I know what he's got.
Well, it sounds like he's got some new onset intermittent tachycardia or arrhythmia. Yeah, he's got a little.
No, I'm going to give you.
No, he's got.
Oh, you suck.
He's got an arrhythmia.
Well, true.
Yeah.
Technically, I think he just has PVC. So there's premature ventricular contractions are a situation where the heart will beat slightly early, which seems not what he has, except then once it beats early, it will pause.
Right.
And so you'll get beat.
Hold.
And then it'll hold. And while it's holding, what people don't realize is just because you're not pushing blood out doesn't mean blood isn't coming back in. There's a lot of momentum to that, because the drive to push blood back in to the heart comes from contraction of the venous side plus contraction of muscles, breathing, all kinds of stuff will drive blood back. Gravity from above.
Yeah. It's like a freight train moving.
Yeah, that's exactly right. Yeah. So it goes beat, and then it pauses, but it's still filling up, and it's like, oh, I'm getting overfull. Oh, I'm getting so full, and now boom. Now it has to pump it back out again.
Catch up, yeah.
And so you'll get these really heavy contractions as the heart is trying to pump out that extra blood.
So what do you do for that?
Well, it depends. Most people have them.
Yeah.
If you put a monitor on every single person, almost everybody would have them during the day, but most of the time they don't notice it. I've noticed it a few times in my life. Athletes, one of the things I would ask them is, do you work out? Do you run? Because athletes who have PVCs, that's actually a sign of a healthy heart. So, but if he's symptomatic and it drives him crazy, there is medication that you can take for him. And one of those medications would be a beta blocker.
Yeah.
And they have those now that are so specific that they really don't cause as much, if any, erectile dysfunction as they used to.
Yeah, and you think other things, hydration, stress levels, stress.
Oh, yeah. All those things can make it more apparent.
Or arrhythmias.
So you want to really know what it is. Let's say you're his primary care and you are uncomfortable treating this until you know what it is.
Sure.
Do you know what we've talked about this test before? Do you know what you would use on this person, given that it's not happening when you see him?
Yeah, no, like a Holter monitor.
That's close. You could do a Holter. A Holter monitor will monitor every single heartbeat the patient has for 24 to 48 hours.
Yeah, especially if it doesn't happen while he's in there and you're listening to the
heartbeat. But if it doesn't happen every day, you won't catch anything.
Yeah.
So what I would use is an event monitor.
Okay.
Now, an event monitor is something you can wear for a month, but it will only record when you push the button. So it's always monitoring your heart. When you push the button, it'll take the 30 seconds before you pushed it and record that, and then record for another 30 seconds. So you get a minute, something like that, however they have it set up. But that's for intermittent kinds of problems like this that just happen at random and you can't catch them happening. And if it doesn't happen every single day, then a Holter monitor won't help.
Mm-hmm.
Okay?
Cool.
All right. So that's what I would do. After I did all the blood work and do a baseline cardiogram and all that stuff and take a thorough history, do a physical.
Supplements included, medications
That's
and
correct.
supplements
Yes.
too. Yeah. Uh-oh.
Give yourself a bill.
Yeah. Because some of the supplements, you can take. If the gentleman's an athlete, he's taking something can throw his heart out of the rhythm too.
What would be some of those supplements, Dr. Scott? Because you've talked about them on this show.
Well, one of my favorites. It's not even legal anymore, but I'm sure they still use ephedra.
Give yourself a bill.
That's exactly.
So there's
right.
a lot and too much caffeine, Dr. Steve. Sometimes they'll do it too. So you never know.
Yeah, energy drinks, that kind of stuff. I would expect that would also cause PVCs. Let's look up real quick. What makes PVCs worse? This is Carl on WATP hates this when you do research on the air. It's like, why don't you just cut that out?
It's the only time we've got to do research.
I know.
Right? We don't have any other time to do it.
Okay, alcohol and caffeine are the two big ones.
There you go.
So there you go. Yep.
Yeah. Cool, man.
Right. Good
well,
deal.
thanks. That was a good question, Dr.
Excellent
Steve.
question.
I like it.
All right.
I like both of those.
Yep.
Hey, Dr. Steve. This is Rex Sexton. And I have a question for you that I've wondered for a long time, but it seems like nobody...
That sounds like some like detective from the 30s or something.
Sounds like
His name was
he's a witness
Rex
protection.
Sexton.
He's in witness protection.
Or a porn star.
Nobody can answer it, whether they're unwilling for whatever reason, and Google does not have the results I'm looking for.
You don't need Google.
The
What
question
got us around,
is,
my brother.
If one was to acquire or develop a lower level STD, let's say, like chlamydia or gonorrhea, is it possible that eventually your body defeats the virus or the bacteria, whatever it is, on its own? Or is it more likely that it will sit there in some fashion in your body, indefinitely until it is cured, and could eventually lead to other problems, such as, for just, a made-up example, a terrible eye infection that renders your eye weepy for probably the rest of your life.
Well, that's a very specific, random example.
Asking for a friend, of course.
Yeah. So let's just use gonorrhea.
Yep.
I mean, Brock Lesnar had diverticulitis and didn't have the surgery, and he had an abscess in his abdomen, and his body apparently was able to overcome that. That can happen. Not every single person that got an STD or got an abscess back in the medieval times died. Some of them did, a lot of them did, but not all of them did. So your body could possibly fight this off. But let's just look at gonorrhea. If you don't treat gonorrhea, it can cause serious and even permanent health problems in both men and women. In women, it can cause a thing called pelvic inflammatory disease. We've seen tubo-ovarian abscesses, which is a collection of gonorrhea and white blood cells in the fallopian tube, and it walls itself off, and then you get these high fevers, and they're sick as hell. You can get scar tissue that blocks the fallopian tubes. That can increase the risk of ectopic pregnancy, which is a pregnancy in the tube instead of in the uterus. That's also life-threatening. You can have infertility. You can have pelvic pain forever. In men, they can get chronic septic epididymitis, which is infection of the epididymis, which is a little structure where the testicles adjoin with the tube that goes into the body, the vas deferens that you cut when you do a vasectomy. And that can cause pain or infertility. And every once in a while, it can go to your blood or your joints and cause septic arthritis or sepsis that can be fatal. So if you got gonorrhea or you think you do, get it treated. Syphilis, we didn't even get into the stages of syphilis.
Get it treated.
Yeah, get that stuff treated. Oh, maybe we'll do syphilis next time. Thanks always goes to Dr. Scott, to Tacey. Welcome back. Thank you, Tacey. It was delightful having you here.
Thank you.
We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, That Gould Girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Eric Nagel, the Port Charlotte Horror, the Sarasota Skank, Roland Campos, sister of Chris, Sam Roberts, She Who Owns Pigs and Snakes, He Who Bones, She Who Owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, the great Rob Bartlett, Casey's wet t-shirt, Carl's Deviated Septum, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and Fez Watley, whose support of this show has never gone unappreciated. Listen to our Sirius XM show on the Faction Talk channel. Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps. Quit smoking and get off your asses and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Goodbye, everyone.
Goodbye.
Goodbye.